When the Uganda Reproductive Health Voucher Project was introduced in 2014, the objective was to increase access to skilled health care to women living in rural and disadvantaged areas during pregnancy and delivery through subsidized vouchers. It would also cater for treatment and management of selected pregnancy-related medical conditions and complications and emergency. The implementation of the voucher management was handed over to Maristops Uganda through the Ministry of Health. Today, the Initiative for Social and Economic Rights, ISA, has come out with its research results in which it assesses the performance of the project in achieving the intended objectives.
If we go by the Uganda Bureau of Statistics assessment of the poorest regions, we all know the northern region is the poorest. The least poor region is the southwest. This project was in the southwestern region. None of the districts that were selected were among the worst performing, with the exception of Buhweju. The Ministry of Health does this district league table where it looks at the worst performing districts in healthcare. So that's usually a starting point. If you're saying you want to go to the hard to reach worst performing areas, you would look at that data and design that. But we didn't see that. Except for Buhweju, none of the districts were there. In fact, some districts like Mitoma had been among some of the best performing. The poorest were often left out. For example, the Office of the Auditor General actually also confirmed this. 68% of the beneficiaries were either middle class or upper rich.
According to ISA's assessment, the design of the voucher program facilitated commercialization of the project, resulting in the exclusion of the poor, who were the initial target.
The vouchers were supposed to be sold for 4,000 shillings, which, like I've said, can still be a hurdle for a poor woman. In reality, they were often sold to the highest bidder. We found instances where they are charging 50,000, 100,000. This has been confirmed by the Office of the Auditor General. Wouldn't it make more sense for us to put this money in a public health system and actually strengthen it?
In an email to NTV, Maristops rejected the details released in ISA's report. Olivia Komgisha, NTV News.